Okay, everyone, welcome back to Aesthetic Chat with Kiki. I am back with Kyra, and I think we decided we're going to talk about melasma in this episode, just because I think that it's come across a lot within aesthetics, and I personally feel like Kyra has really dialed in her knowledge and expertise, and she's really great at treating it. So, Kyra, welcome back.
Hi, happy to be here. So I think that the best way to start is rather than kind of going over the pathophysiology at all, we're just going to kind of skip what causes melasma and all of those features of it and dive more into just like treatments and common misconceptions about, melasma treatments and best treatment protocols, best skincare protocols, and we'll just kind of oversimplify melasma for those that don't know what it is as just a pigmentation of the skin that flares, hormonally. Typically, it's also flared by heat and light, and it will be referred to as kind of the mask of melasma. I personally have melasma and it affects my forehead and like that little like mustache area, your upper lip. A lot of other patients will get it like on forehead and cheeks. It has a very characteristic appearance to us in dermatology and aesthetics where it has kind of a patchy pigment. And again, it flares when you're exposed to heat or exposed to sunlight. There are other flares for it too, but those are typically the main ones. Other sources of energy like lasers, things like that, that are a wavelength of light versus like sunlight. Those things can aggravate and irritate melasma as well. But I think that it's something in aesthetics that can be addressed inappropriately. There are a lot of pigment treatment creams on the market, that are kind of trying to woo consumers to think that they treat melasma when realistically they don't. Their active ingredients are typically brightening ingredients, things like niacinamide and other, brightening ingredients that don't really address the underlying cause of melasma. And even our best treatments for melasma, again, don't address the underlying cause, which is kind of why we're skipping over the pathophysiology. A lot of them, the best they can do is kind of put a pause on that pigment production, because melasma has a lot of underlying factors. And again, it seems to be hormonally regulated for a lot of people. So that's one of the pieces where, we're not going to dive into the hormonal regulation of it, but it is something that should be worked up prior to even getting aesthetic treatment, typically, if we think there's a hormonal component that could be well addressed or controlled. So by the time they make it to us, typically patients have, either had a workup or have not. We'll refer them out if they haven't. If it's something that we're like, this is a little bit suspicious, or they have other symptoms that are going on simultaneously. Otherwise, it's one of those things that's just a really stubborn annoyance more than anything else. And I can speak from that personally. It's one of those pieces that, again, it's going to kind of flare every summer for people who are in warmer areas, or even when you're on vacation. And then you're going to kind of try and treat it when you're in like those fall and winter months, and then get it into a period of repression. So you're really not fixing the problem per se when you're addressing it this way, but we can kind of make it essentially disappear, but we know that it's still there if we're not repressing, that melanocytic or that pigment producing cell activity.
So, quick question for you. I think this may come up for people that are listening. So, people that are like, I do not know how to even approach melasma. And you mentioned, having them being worked up by like a PCP or maybe their OB-GYN. For either the patient or the provider, what would you have the patient go to their provider and ask them to work up? Like what labs, what would you have them do?
It's a great question. And honestly, everyone's a little bit different about that. I think that I really find that functional medicine doctors thrive in this space sometimes more than traditional primary cares. Not always. I mean, I still have my primary care in Chicago because I literally love her. And our supervising physician is a functional med doc, and he's amazing. And so I'm able to use them both. So I'm a bit spoiled in that space. But you really want to make sure that if there are other hormonal conditions that are kind of going on, you'll see those patients where they have almost like that hallmark PCOS plus melasma, which is a really interesting combo, where it's like they have the cystic acne, they have the hirsutism, the hair growth on the face, they have melasma. You want to just make sure that anytime that we're addressing something in the aesthetic space, it's been appropriately worked up in the actual medical space before they get to us. If it's someone where it's like, I got pigment on my face when I was pregnant, and I haven't had that an episode since then, you you look at them as like that person had melasma, but if they're not actively flaring when they're exposed to heat and light, that melasma is in remission. So there are certain patients where it's like, you know what, you are actively dealing with, a potential hormonal issue, whatever that may be. I do like them to see someone just to get worked up. Now, if they've had their normal labs, and everything comes back within normal ranges, does that mean that they don't have, melasma or PCOS or any of those things? No, a lot of those diagnoses are incredibly complex. I'm talking more about those red flag patients, like I was saying, where it's like, okay, there's something else going on here. I want to make sure you're getting evaluated appropriately before I just dive in and try and treat your melasma when there are underlying things going on. Again, if it's someone who it's like, oh, I got, pigment when I was pregnant and I haven't had an episode since, or ever since I was pregnant, I've had these like just issues with pigment, like on my cheeks and forehead, anything non-concerning, we can address that happily. But those red flag patients, or anything that you're ever just suspicious of, just have them get, a good solid workup from a functional medicine doctor or their PCP if they're willing to do that with them. Even acne patients, because there are other factors at play like hyperandrogenism and things like that. And that's what we're finding. Like a lot of people are kind of treating with spironolactone and other things like that when a patient might not have hyperandrogenism. It's just something that I think that, skin is our biggest organ. And a lot of times it's oversimplified by a lot of providers. And it's just important to remember that, we don't want to address something that has an underlying cause that could be fixed.
Absolutely, yeah, because you're talking about your approach being more suppression, right? And so if there is an underlying cause, then definitely addressing that.
Yeah, and it's like the same way if you see a patient and they're there for a laser and you think like, you know what, that little spot on your nose looks like an AK. Don't treat them with laser. Send them to their dermatologist, have the dermatologist address that, get clearance from them. Those are things where it's like if you have a background in dermatology, amazing. Like I literally had a patient 2 weeks ago and I looked down at her face before we were doing laser and I go, that's an AK. So I quite literally sent her to her derm and of course it was like an AK. It's like that hallmark classic, like actinic keratosis. They froze it off. Derm was like, absolutely, yes, please do proceed with, BBL treatments. That would be incredibly helpful for this patient. Great. Everyone's on the same page. I think that it's important, again, to remember like it's aesthetic medicine. It's not like aesthetic foo-foo.
So stay in your lane if you don't have that knowledge base and essentially don't do harm, right? Like don't be working outside of your wheelhouse.
100%. And it's one of those pieces where it's like if someone can address like an underlying hormonal cause of like any of their skin issues, you're doing them like a service for their entire body. And so it's one of those pieces where it's like if you can address that, then you can fix whatever like residual problems there are with their skin. But you have to address the health component first and then come back with the skin component. There's certain things where it's like mild rosacea, stuff like that. Like I like my patients to be getting, regular checkups. But certain things where it's like, again, mild melasma, mild rosacea, those are pieces where I'm like, you know what? These are things we can very easily address. I'm not concerned. But anything that, has an underlying cause that you're looking at it and go, this is a really complex case, like address it from all angles, including internal. That's something that I think is really difficult. And we talked about this a little bit on our last episode of, even things like acne, where it's like you have those providers that are like, oh, unless you're rubbing a piece of pizza on your face, like what you're eating isn't causing your acne. Not in so many words, but inflammation causes a lot of other problems. If we can reduce inflammation in the body, we're not just helping the skin, we're helping every single organ system. So I think it's important for us to kind of just remember to just even like remind our patients, like, hey, make sure you're doing, these regular things. They can help kind of reduce, your rosacea. Just even pay attention to what your triggers are, whether it's like acne or rosacea, because if it's causing inflammation in your skin, it's likely causing inflammation in other places. And again, the science on a lot of the inflammation, cascade in our bodies, it's patchy. We're getting more knowledge on it, the more research and data that we have available. But it's definitely one of those things that if it's something straightforward, you're like, every time I go in the sun, these spots on my cheeks and forehead and come up, or if I'm wearing a baseball cap or if I'm somewhere really hot, like that's beautiful hallmark melasma, right? It's like that little pigmented patches. I have it again on my forehead. I know that if I'm outside, exposed to sun and I'm not protecting those areas, or even if I am with a hat, I will get that beautiful little rim right across where that hat sits of melasma. So diving into treatment wise, I think it's important to address what is typically done incorrectly with melasma.
So talk about the typical protocol that majority of people have probably tried prior to seeing you and then your version.
And the reason I went back to kind of like that identification of it is because it's important to think of when we have melasma, we have pigmented skin, right? So that skin that we see, like those spots that we see on our skin, that's stained skin. So think of it in that really simplistic way, stained skin. The cells underneath the skin are still producing more pigment, right? So they're continuously staining the skin. They're adding more pigment additionally on top of that to those new skin cells that are kind of coming up to the surface, right? That's a super simplified way of thinking of it. So you can't just address the cells that are currently staining the skin. You also have to address the stained skin. If you do just one of those things, if you're addressing the stained skin, it's like, okay, you're sloughing off that stained skin, but if you're not addressing the cells that are producing new pigment, that skin is going to continue to stain. And so you're not going to really see a pigment improvement. If you're addressing the cells that are staining the skin, okay, that's great. You're putting those to sleep, but you still have that stained skin superficially. So although over time, theoretically, you would see some improvement, it's really minor, and patients get super frustrated very quickly if they're not seeing improvement with melasma and pigment in general. So it's important to address the currently stained cells and also the cells that are doing the staining. That's why the current protocol, which is to typically just put patients on a hydroquinone cream, it's a prescription cream that essentially puts those pigment producing cells to sleep. And they put you on this cream typically once or twice a day. Sometimes it'll be in pad form, sometimes it's in liquid form. And basically they're like, okay, this cream, you can only be on it for, 3 to 5 months. This cream is going to stop those pigment producing cells from producing pigment. Great. Yes, it does. However, those stained cells are still present. And so patients are like, I did the hydroquinone cream for, however many months I can do it, and I didn't see any improvement. Of course you didn't, because we didn't address those cells that are already stained. The other part of that is a lot of providers, girl, they don't even give people the 3 to 5 months piece, And it's so important to titrate and put patients on and off hydroquinone, because number one, we know that if you're on it for an incredibly long period of time, which is why it's regulated so heavily in so many different countries, is without any melanocytic activity, we're losing protection from our skin. We're losing skin protection. And so it can actually increase your risk of different types of skin cancer. Again, this is with really prolonged usage in certain patient populations, in certain settings where it's like, I've been on hydrocodone for 5 to 10 years.
I mean, you see it though.
You do see it, and it's not regulated. When you aren't given instructions, how would you know how to use it? If somebody handed me a tube of something and we're like, here, put it on your face twice a day, and they were like, bye, I would use it twice a day forever, right? Like assuming like, great, this is healthy. I can use it twice a day. I need clear, firm instructions of how I can use it, when I can use it. Make sure that you're telling them like, hey, you really need to be on sun protection. All of the caveats, the risk. I tell people the scary stuff too, because it also explains why I'm saying something. It's like, I don't like the because I said so answers for anything as a patient, so I don't give them as a provider. So that's one of those pieces, like the lack of guidelines with that are also what fueled, some of the complications. Typically, those have been overseas where it's just a lot less regulated. Actually, Asian countries have a problem with that as well. There are some other complications where you can develop a really severe form of hyperpigmentation from prolonged hydroquinone usage. We won't go into that, but it causes this really deep purplish pigment. Very, very interesting. Not something you want to encounter. Super difficult to correct. So hydroquinone is very good at what it does, but there are risks that come with it if the use isn't regulated. So that's one of those pieces where, okay, we're giving you this cream, right? And it puts those pigment producing cells to sleep. Patients are using it for X amount of time typically, or they'll even use it for a year and go, I had to use it for a whole year and I didn't see any difference. Again, because those stained cells that are on their skin are already present, right? The hydroquinone isn't correcting any of those. So when you use an effective hydroquinone, you have to use it as a system. So Dr. Obagi does this incredibly well, like the ZO Health. So again, the hydroquinone puts those pigment producing cells to sleep, but you have to slough off all of that damaged pigmented skin.
Mm-hmm.
How do you do that? Aggressive retinol usage. Again, you want this done by a professional medical provider. This is something that you will need someone to help walk you through typically. If you're using like a system at home, even aggressive retinol usage, some combo creams will kind of mix retinol, a steroid, and a hydroquinone to atrophy the skin while they're turning it over with the retinol, while they're putting the pigment producing cells to sleep with the hydroquinone. However, they're just not really effective. They're okay, they're okay, but without a little bit more of an aggressive skin turnover, they can only do so much. The aggressive skin turnovers have a downside of your skin is going to be peely, it's going to be irritated, it's going to be red, it's going to be itchy, but man, your skin on the other side is so good. I mean, Obagi literally, I think this is like what he's known for, right? Like his peel systems and all of that stuff. And I truly have found his protocol to just be the best on the market out of everything that I've had patients try because he has, he has the peel pads, he has the exfoliating polish, he has the cleansers that are effective. He has his own hydroquinone, but I've actually bootlegged it with other patients with just over-the-counter hydroquinone because it saves him a couple $100. You can bootleg, his system by kind of copying it and just using other peel pads and other exfoliating polishes and other things. I swear though, his is just more effective. I don't know if it's the active ingredient concentration or what, but it really does an absolute number on melasma. And I will also actually use it coming into acne to reset patients' skin who have that really severe, really stubborn acne and those acne rosacea combo patients. If they're like, listen, I have a limited amount of time, I just need to slough this layer of skin off. Let's just get down to that fresh, new, healthy skin. I love it. Like it's absolutely phenomenal. So that's one way to address, melasma at home incredibly effectively with, I'll never promise you 100% resolution, but like high 90s%.
Good percentage.
It's a great percentage. And if you are able to repress the melasma after that, that's where you can, do either a mini peel the following year, or most of my patients don't need anything. I mean, I can typically repress my melasma very effectively with a combination of, different peptide-based ingredients, different pigment-based ingredients. But I got to tell you, 90% of pigment creams on the market suck. They're terrible.
I know. You could go on and on, actually. We aren't trying to get sued on this podcast, to clarify, everyone. And we also are not affiliated with anyone. So this is just
personal opinion.
And this is also not medical advice. So I would like to put that out there.
Nope. We are medical providers, but this is not medical advice, and please don't take it as such. So that's your kind of at-home protocol. It has to be peeling. It has to be red. It has to be irritated. It has to be aggressive. Now, some patients will kind of quell in 6 weeks. I didn't when I do it because I have rosacea, and anyone with underlying rosacea, right? Like you're going to be kind of miserable the entire time you're doing it, but dang, it's effective. It's so effective. Patients that don't, they typically kind of adapt at that 6-week mark, and they do really well. And they're still sloughing. They're still turning over. They're still having really beautiful results. He, even in his little books, like his little booklets for the prescribers, has pictures. Show your patients pictures. Show your patients pictures if you're a provider doing this and say, this is what your face is going to look like. It's going to look crazy. It's going to look peely. It's going to be red. It's going to be stingy. It's going to be irritated. It's beyond retinol-induced dermatitis.
Yes.
Well, your face will be falling off. And I really do tell patients that. And you do too. Like we're both the same way where you're like, do not be alarmed. Like you will be like a sloughing lizard in the best possible sense.
If you're honest up front, it saves you so much time, so many text messages, just in general.
100%. And I think patients appreciate that too, because I never want someone starting on a skincare journey where I'm like, you're going to love it. When they're like, they would call you in a week and be like, I hate you. My skin is falling off. And and people will genuinely, like when I started in the industry, I was softer with that explanation. Now I'm like, your face is going to fall off and it's going to look great later on. Push through. Because at the beginning, I'm like, okay, it's going to be irritated. I'm like, it's going to feel like hot fire when you apply these products. Do not be alarmed, because I remember even doing it myself and being like, oh my God, I wanted to stick my head in the freezer. Makes it worse, by the way. But those are things where it's like, if patients know, you're not going to get that emergency call of like, I'm having a reaction, or, I'm having like an allergic reaction. I'm like, nope, that's exactly what you want with this, 100%. Now, if you want to skirt that, right, as a patient or a provider, best way to do that is going right for a peel as opposed to an at-home system. The at-home system is so much less expensive, very, very effective, and dare I say more effective than some, in-office procedures. Actually more effective than a lot of in-office procedures, depending on who you ask. Peels are the next best thing for melasma because we're not emitting light, heat, or energy into the face, so it's not going to flare the melasma like it would theoretically with a light heat-based laser device or a light-based device. You and I have done a lot of deep dive in Cosmolon peel because they recently changed their formulation because some of the ingredients like hydroquinone have been limited internationally and nationally in terms of who's able to prescribe them.
The EU is just going away from hydroquinone, is at least my understanding.
They are. I think it's so stupid because it's such a great product that's like that just needs to be well managed. Like people can die if they take 100 Advil. I'm not going to tell you not to take 2 Advil. Again, this is not medical advice because you could die if you take 100, right? It's the same exact thing with hydroquinone. If you're using it continuously for years on end, it's a prescribed product, right? I'm saying absolutely don't have it over the counter. I don't think that people are able to manage it safely because they just genuinely don't know, and that's not their fault. It needs to be managed by a provider. But if it's managed well by a provider, it is amazing, life-changing, incredibly effective.
Was it just over the counter in Europe? Is that like some of the regulatory issues?
I know that it was over the counter in Asia, and I don't know in Europe if it was over the counter. And I know the ruling in America was really interesting because it used to be like you didn't have to really get a prescription for it, but it was like the sale of it was kind of controlled, but very loosely. Like there were ways to kind of skirt the system. In the EU, I'm genuinely not sure how it was available previously, but I am frustrated with the fact that all of these different companies are now kind of changing their formulations across the board. And we can't have it either because of that regulation. And I understand where it's coming from because there are risks associated with it, but only when it's used so poorly and so incorrectly, you could make that argument for any medication.
True. So, which peels do you recommend if people are like, I really don't want to do the Obagi, like my whole face peels off? Like, what is my alternative? I just don't want to do that.
It's a great question. Now, your whole face will still peel off, but in a shorter period of time. Genuinely, like you have to get to a depth where you're actually appropriately addressing that melasma. And with that, Cosmelan was always the gold standard peel for this. I don't necessarily, I cannot vouch for the new version like I could vouch for the older version. It would be great if we had other feedback on that. You've had some providers that have been using the newer version of it, which essentially they're relying on a higher concentration of retinol and other active ingredients as opposed to, the hydroquinone and some of the other things that they removed from their previous formulation. It's still on the table. I just can't vouch for it as highly as I could previously. Not to say that it's not just as great. I just haven't used it as frequently. Jesner's peels are incredibly effective for melasma as well. Obagi has some really deep peels that, his clinics can offer or clinics that offer ZO can do. Not the superficial ones. You need like those very deep, aggressive peels because you want to get to the level and the depth of that pigment. Superficial, those really light peels that aren't going to get that really nice, deep kind of sheet peeling, they're not going to do enough for you. Now, if you do them consistently over time, right, like you could theoretically peel off that pigmented tissue as it's kind of sloughing to the surface, but you would still really want to support that with a really epic skincare protocol. So I would say, if you're going to do the peel, like Cosmelan or Dresner's would be my absolute 2 picks for that. Even the newer version of Cosmelan, I think you're going to peel a lot longer with that one because that's very similar to kind of the Obagi at-home protocol now. You're getting like 6 to 8 weeks of peeling, whereas before it was genuinely like a 7 to 10 day and then like a little bit of dryness.
So, are you talking with Obagi? Are you talking about like the 3-step peel? Or are you talking about like his sedating, like a phenol peel?
It doesn't have to be the phenol pill. No, it doesn't have to be like the sedation. I have to remind myself, I don't do a lot of peels in clinic personally. So off the top of my head, I can't remember which one it was of his. I will look it up and get back to you on that. Because he has a couple different peels that are like lighter peels. They're great peels, but they're just not great for melasma. I can't remember what his more aggressive one is called. So I can circle back and give you that info. There is a very specific, like 1 or 2 that he offers that would be deep enough. Obviously, the sedated peels would be deep enough to get that.
If you're a provider and you're like, oh, you should do a peel, doing like a quote unquote like lunchtime, no downtime peel is not going to cut it.
No red carpet peels. For this. No red carpet peels for this. Yes, no fire and ice type peels. Those are amazing for other things. It's just not deep enough for melasma. And there are certain skincare brands and things that will have you do a series of peels over a period of time. But for me, it really also comes down to cost. If you're doing a $500 or, $600 peel or even a $400 peel, and you have to do it every single month for 6 months, that's a lot of money. And if you're not getting full resolution of every single thing, or again, in the high 90s, it's not worth it. And a lot of those are, again, they're typically just lighter peels that people will have you do it in a series in the hope that the pigment, as it rises up, is able to be sloughed off from those more superficial layers of skin. Put in the work, do it up front, do a deeper peel. It will do you a much better service than trying to get at it with superficial peels. Just caution patients against it. They're not seeing enough improvement fast enough. And this is one of those things we actually can improve fairly quickly. And so I like them because they've struggled with it for a really long time, and they've dealt with a lot of frustrating pigment. I like them to be able to see that improvement faster. And Cosmelan typically sits around like $1,000 a treatment. So if you're looking at like $500 or $600 superficial peels and you have to do 6, look at the cost differential, right? That's massive. Do the one expensive peel that you may, Cosmelan, you might have to get touched up afterward. Typically it's included in that peel pricing. 6 $500 peels, that's 3 Cosmelans. Like that's 3 years of, even if you didn't control your melasma at all, you could retreat and get like great resolution every single time.
Right. I was gonna say Cosmolan, it's like, and honestly, like 1,000 is low now. Like it's 1,100, 13, $1,500 now. So, I mean, because you do a lot of the ZO protocol on average, like ballpark, what is someone looking at for like a pigment protocol by ZO?
I would say like 400 to 600. I mean, and that includes like everything, right? Like that includes like your months of product, like your transition off. Those are things where I typically follow that one very much by the book. If we're trying to save a couple dollars, yes, you can use other hydroquinone, but a lot of pharmacies are using an emulsification that I don't love for acne prone skin. I can't remember the active ingredient. That's another one. I was like, I'll look it up. It's just one of those things that like almost every single pharmacy is now using that in their hydroquinone. And it's really frustrating because you used to be able to get around it and now you can't. So that's why I've kind of just gone back onto using Obagi's, because his is really great for acne prone skin. Because there's nothing worse than being like, we're treating your melasma. Now you have breakouts, right? So that's why I tell people, like, stick with Obagi. Do not venture outside of that product line the entire time you are on that regimen. Like ZO only for that period of time, and your provider will likely tell you the same thing until you're titrating off. So that's just, his product line is incredibly concentrated. Does not play very well with other product lines. When you're doing that really aggressive peeling, just stick with his stuff. It's absolutely worth it. And again, I'm not sponsored. It just works really well. And I've tried a lot of other things, and I'm a patient that gets frustrated easily. So if I'm not seeing change, in a certain period of time, I'm like, this sucks. So that's where my protocols come from. I'm like, it's for impatient patients, right? That's my vibe, where I'm like, how quickly can we do it? And I'm realistic with patients where I'm like, okay, the other realm you can go, right, is in-office treatments. If you're not doing a peel or you're not doing, the at-home protocol. And that's where we come into like the laser and light-based things. You have to be on a hydroquinone protocol for at least 2 weeks before you do laser and light. Doesn't have to be the peel protocol, just has to be a hydroquinone. It can be prescription, it can be, the ZO. Those are the only 2 options you have. I don't care if it's compounded or from, Rite Aid, it doesn't matter. But you need to put those pigment producing cells to sleep before you undertake anything with laser, light, heat, or even some patients with severe melasma, even microneedling can flare them, because just the amount of, blood flow and energy that's kind of being emitted into the skin, even though it's not the same as like energy from an ultrasound or energy from, a light-based device, there's still like damage and circulation that's being brought into the skin and heat that's being brought into the skin by the procedure itself. So those are things that you want to make sure, you're repressing those melanocytes, those pigment producing cells, from causing new pigment while you're treating that patient. This is a mistake I see so much in aesthetics. I cannot harp on this enough. Do not treat any patient with a history of melasma or current melasma with a laser, light, or heat-based or energy-emitting device without putting them on a hydroquinone for 2 weeks beforehand and then tapering them off after. This is my number one patient that I receive from other aesthetic clinics that have not done this. And they go, so I had some melasma before, and now I have way worse melasma because I did this blank laser, and now all of this has come up to the surface.
That's so sad though, because like if you're going in trying to treat something and then it gets worse,
Yes.
that's sad.
And you also spent $2,000 on it.
Right. With your 2-week pre-treat, does that include like a TRET 0.05% in there, or are you just saying just hydroquinone?
So I want them, before I do any type of laser on them, just for their own benefit, to be on some form of retinol or retinoid. I just want it to be medical grade, genuinely, because we have studies, where it shows us that being on a 0.05% or a 0.1% tretinoin prior to any laser procedure reduces your risk of post-inflammatory hyperpigmentation. It reduces your risk of scarring. It reduces your risk of other complications. It also accelerates your healing. You get more out of the laser. You've also sloughed off that kind of old, icky, damaged skin, for the patients that aren't doing anything prior to, and you're getting more out of that treatment. So where patients, were previously, it's like they've never done anything. They like aren't using any medical grade skincare. They're not doing, any protocols at all. And they're going to do a laser. I tell them, I'm like, non-negotiable. I either want you on name drop, but like Skin Better Science, retinol for 4 to 6 weeks, tretinoin for 4 to 6 weeks, like Zio, like a medical grade brand. And the only reason I throw out the name of Skin Better is because the patients that are like, I don't want to peel, I don't want to have any of that, I don't want to deal with any redness or irritation, throw them on Skin Better. It will save you so much time. And genuinely, anecdotally, I don't have data on this one, but anecdotally, it reduces their risk of having any issues with that laser. They heal faster. They get so much more out of it. I always tell them doing that for 4 to 6 weeks before your treatment series will save you 1 to 2 full treatments. So when you look at the amount that you're spending on those two products for 7 months, because I put them on their antioxidant too, you can have a 7-month worth topical for less than the cost of one, light-based treatment, and way less than a cost of like a laser-based treatment. So I like to mitigate any risk or complication as much as I can. So whenever I'm doing any type of procedure, even something like a BBL, I'm like, I want you to be on this. It's for you. It's not for me. I could very easily just do another treatment, right? Or another 2 treatments and say, I'm going to charge you $1,200, or $2,000 and do these extra 2 treatments. I promise you, that recommendation is 100% for my patients. Also because their skin is going to be supported throughout the entire thing so much more effectively. We know all of those complications actually, that those risks are truly reduced. We have the data on that. And afterward, they don't have to switch on to any different skincare. They already have all their stuff and their skin is acclimated to it. It's happy. And so we're protecting the investment. We're putting in the work up front. We're getting the killer results with the treatment, and then we're protecting the investment afterward. And literally, you're saving money at the same time. I can't stress that enough. Put in the work as a provider and a patient to just explain this to people. And everyone is so grateful to be like, oh my gosh, this saved me thousands of dollars upfront and down the line.
100%. Well, also, I will say, they don't love the entire Skin Better line, but I will say that if you put someone on Alpharet, I wouldn't say melasma, right? They have pigment. If you put them on Alpharet and you put them on Alto, antioxidant, even when you see them back 2 weeks later after you did, a wrinkle relaxer or something, you see an improvement in pigment.
You do. And they do. And they see an improvement in their skin. Just that barrier health is amazing. It's one of those things, it's absolutely crazy. And it's fun because I actually got introduced to that line because I was when I was rotating in plastic surgery in PA school, the plastic surgeon working there had expired product that they were going to throw away. And they were like, well, do you want this? And I was like, sure. I was like, what is it? And he's like, it's Skin Better. I was like, I've never heard of this before. And I genuinely saw a massive improvement in my skin with that kind of just that, that mild rosacea, the enlarged pores, that little bit of pigment. Because I wasn't really doing, a lot when I was in PA school. I just didn't have any money. And I was like, okay, I had the SkinCeutical C, which is still great, and a couple other choice products. And they were expensive. They weren't cheap. But when I tried those 2 things together, oh my God, my skin was thriving. So that's where, you said, when you see them back, or if you see them back in 4 to 6 weeks to just do a check-in, their skin looks so different even in a photograph.
So for someone who comes to you, they've dealt with pigment, but they don't have any red flag concerns where it's they need to be worked up, right? But they're also not doing anything medical grade. They're not doing any skincare really. Maybe they're using a bar of soap or something. Would your go-to be starting them on, again, medical grade skincare regimen agreeable to the skin, like Skin Better? Or would you take them down that rabbit hole of full ZO, slough the whole face when they are, again, using nothing?
Is this a melasma patient, or is this just kind of a general pigment from, sun damage, kind of that solar lentigo type B?
Answer for sun damage and then answer for melasma.
First, I actually asked the patient. So I ask them what their number one concern is because I want to know like what they want to address. Because there are some things that we'll see as providers that we're like, okay, like if I'm making a list in my head, right? My list is different than your list. I want to know what your number one most important thing is. And I want to address it that way. The other thing I'll also kind of do is see like, are you willing to go down the rabbit hole with me of the face falling off? Because if you are, and it's like, pigment is my number one concern. I have melasma. I'm super annoyed. I want it gone as fast as possible. I've done other stuff. It doesn't work. Let's get at it. I show them the pictures of like, the skin falling off. And they go, let's do it. I'm all in. I'm like, jump in that day. Here's everything. Start using it like full on twice a day, exfoliation, pads, all of that stuff, that full protocol, and just jump right into it. You'll acclimate faster. You'll be miserable for 4 to 6 weeks, if that, and then you will have phenomenal results. But if it's a patient where they're like, I don't want my face to fall off, which is also totally okay, right? I'm not going to go, well, if you don't want your face to fall off, I can't work with you, right? It's just going to be an explanation of like, hey, awesome. I understand. I sometimes don't want that either. A lot of times I don't want that either. And, unless you're addressing something that like you really can't fix without a really aggressive like downtime period, I will also be honest about because I'm like, I'm never going to just take someone's money and not give them, a result. I work with them and I say, okay, that's absolutely fine. It's going to take us a little bit longer to get there. And that's okay. Like that's 100% okay. Like if you open to those patients where it's like, you know what, they haven't ever done anything with their skin and, maybe they were really sensitive to certain things, like I'll titrate them onto even alpha red just to make them comfortable. Could they probably start using it every single day? And do I have this exact conversation with them? Yes. I'm like, you could probably start using it every single day. It's such a mild product. It's so gentle, but because you've had issues with the past, let's just work with what you're comfortable with and start every other day, or every third day and do that for 1 to 2 weeks. And it's like, as long as you're doing well, increase that until you're using it every single day because that's our goal is I need you using it every single day. And then I kind of go into like how retinols work in the skin, how they, actually change the expression of the DNA in our skin cells, all that fun stuff. If their eyes start to glaze over, I'm like, okay, let's pull back on the science. But those are things where I'm like, your patient also, they need to have autonomy. You're in their world just as much as they're in yours, And I think that that's one of those things that you'll have some providers that are like, nope, it's my way or the highway. And I understand that with certain things, right? Like there are certain areas that I'm not going to treat with Botox unless you let me treat another area with Botox, right? But there are other areas I'm like, okay, if you just want to treat your crow's, not a big deal. Same thing with skincare, where I'm like, there are certain things where I'm like, okay, I can't get you the result that you want unless we're able to do these things. And I'm going to be upfront and say, wait, if it's a money issue, wait, save it. Let's get like everything set aside and then let's do the whole thing and do it the right way. If it's, a downtime issue, if it's something that we can accomplish by just kind of adapting our procedure and our protocol, absolutely okay. The crunch time comes in when we're dealing with hydroquinone. The crunch time with hydroquinone, because we have, that 3 to 5 month window, which again, depending on tapering and depending on who you're talking to, has a little bit of buffer time. That's where, if you have someone with really severe melasma and they've got a ton of pigment and a ton of damage on their skin, and you have that short window, I kind of need you to go ham with me because if you don't, you're going to be disappointed in your result. Now, I have some patients where it's like, okay, I have 3 months, right? Where I could normally give them like 5 just because of the hydroquinone because either they have an event or something else, or it's seasonal and you're like, I know that the sun's going to be out in the Pacific Northwest starting in June, or even May. Like I'm going to stop their treatment in April and I need them to, stay protected and do the smart thing over the summer. But I'm going to say, okay, even if they're okay with getting 20% of it, improved in that amount of time, great. Let's knock the 20%. But if you have a patient that's really severe melasma and doesn't want to peel at all or doesn't want to do any, light or laser-based treatment or go on hydroquinone, I can't fix that. I wish I could. If I had a magic wand, girl, I'd wave that thing all day long. But if they're not willing to do whatever the necessary steps are with you, you can't take them on like that skincare journey. But, you can customize it depending on the person. so much, but there are cases where it's like, your result is not going to be possible with the commitment that you're able to give, whether unfortunately if it's financial, if it's time, if it's downtime, those are things where it's like, if you're not going to commit 100%, I'm not going to take you on the journey with me because you're going to end up disappointed. And I don't want to disappoint you. And I don't want you to waste money. So I'm like, you have to either go all in or not at all. The non, hydroquinone based things, the non, melasma based like treatment protocols and pigment protocols and things, that's kind of a different thing. And you have a lot more leeway with that because you're not on a time crunch.
So for talk a little bit about like your non-hydroquinone protocol. Maybe they did the sloughing with the ZO. Like how are they maintaining their results when they're cycled off?
So when they're cycled off, you're always going to titrate them off of the hydroquinone with another supplemental brightening product. The most effective one that I've truly found on the market is Elastin Illuminate.
I knew you were going to say that.
I was going to say I'm name dropping everywhere because I've tried so many different ones and most of them again are like they're more brightening than they are pigment, right? And I just like that one the best because it does the best with most people's skin. And I truly believe that tranexamic acid, which is, they actually will tell you that that's not like the main ingredient that's doing the work in that. And I understand what they're saying. Like their peptide complex is like basically those peptides are supporting like the skin rejuvenation. And if you're thinking about those old damaged pigmented cells getting cleaned out, right? Like they're saying that the peptides are doing a lot of that, which is great, right? Which also sets their product apart because even if you use that on someone who you're not doing, full hydroquinone protocol with, you actually will see results, which is very different from most other pigment products. So shout out to them for that. So the tranexamic acid, actually, when you look at it, and we have, again, the data on this, it's really cool. There are some really cool NIH articles. Look it up if you have time. The properties of tranexamic acid and kind of mimicking that effect of hydroquinone, but without having to cycle on and off, are amazing. So that's one of those things that I think that really sets it apart. And it's funny because I said this like 5 to 10 years ago when some of that data started coming out. And I was like, this is going to be the future of pigment products. And I remember some of the people were looking at me like, all right, whatever, crazy lady. And now it is. And again, we have the data to prove it. So that's really cool. And as long as the emulsification, the formulation is delivered appropriately, there's no reason to think that like tranexamic acid isn't necessarily the future. So I have them titrate off of that hydroquinone and onto the Elastin Illuminate. And you can use other bridge products, right? Like when they're on the full Obagi protocol, I'll typically have them titrate onto the ZO Right Alive. It's just not a great standalone product. No shade. The Elastin Illuminate is absolutely killer. And the Bright Alive also isn't great for patients who are acne prone when they're not on that full ZO protocol. They kind of like it when they're on the full ZO protocol because it's really nourishing. But like if you're acne prone and you're not on full ZO stuff, it can be a little bit heavy. So I typically will transition everyone onto the Elastin Illuminate because I want them on that in the summer and those months when they're exposed to heat and sun. So just product description, right? Like day and night, stay on that all summer long. And anytime you're exposed to, like, if you're somebody who does hot yoga twice a day or once a day or anytime, or you're taking even super hot showers, anything that's really elevating your body temperature, stay on it twice a day. If you're someone where like, I'm not exposed to like any light or anything else outside of summer months, great, you can reduce it to once. But past that, I just have them continue to use that single product. Now, I still want them on, their regular skincare. Like they need to be on some kind of retinol. They need to be on some type of antioxidant. But if those are like their only issues, right, where it's like just that and pigment, great. That's all they need.
Infrared saunas and sauning is really big and hot yoga is really big. I didn't think about the impact that it would have on melasma because you think of like heat and light, right? But I think of like direct sunlight. You're getting a lot of heat exposure with red light sauna.
Mm-hmm. And that's another thing, like even with sunscreen, you know what I mean? You want to make sure that you're picking one that has not just like UVA and UVB protection, but you want one that has infrared and blue light protection as well. Because think of the amount of infrared light and blue light that we're getting every day. I mean, like I literally have 5 screens in front of me right now. Okay, that's an exaggeration. It's 3, but still. We've got like the TV, I have my iPad, I have my laptop, and I have my phone. Like, whether or not like all 4 screens are emitting simultaneously, you're still getting some element of that. Like most of us are in front of some type of screen for a large portion of our day. So you want to make sure that as much as you can, you're filtering out those, wavelengths of light as well.
And another like skincare plug. So top 3 SPFs, go.
Ooh, okay. Elastin, Skin Better Science, Color Science.
In that order?
In that order, because And I actually use a combination. Like I like to use like elastin and then I'll use the Color Science Glow on my neck. I like that just because it's like it's hydrating, it doesn't break me out. It's just kind of a nice, like it gives you like a little bit of like a shimmer. So it just looks like really flawless. I'm typically like a different shade in the winter if I'm doing like a little self tanner or if I'm like outside in the sun, which I do love the sun. I know even as an aesthetic provider with a dermatology background, yes, I like the sun. I use my sunscreen. That's why, I wear that on my neck. It's just easier to do neck and chest with that because it's like it's not really a tint per se. I will say the biggest problem that I have with sunscreens, like the sunscreens that I love, they are very difficult to find matches for darker skin. My darker skin patients, like we're pigeonholed into using, the darkest shade of Color Science if that matches them, or even like the bronze Color Science, because that has a really nice sheen to it and it's still very protective against the sun. But like Elastin is a one shade. They have one shade, it's tinted. It fits some people, not all people.
Is it too dark for you?
Not me, because I love a little bit of like a Luna bronze glow, right? So I just use that little mist. Like I like to have that little bit of like an underlying color. But yes, if I had nothing on my skin and I didn't do like my little tinted, it's not even like a tanning lotion, but kind of like it's like, it has a little bit of a pigment to it. So I don't look like a deathly ill Victorian child in the winter. If I didn't do that, yes, it would be too dark for me.
Okay, because I love elastin too, but I run into the issue when I am more tan, everything casting.
Too pale.
Yeah. I can't use the Skin Better Science one without like mixing it with a Color Science or something else.
The Skin Better Science has a green undertone. And so the green undertone is amazing for patients with rosacea and red skin. Or like if I'm like not wearing like a stitch of like, my little tinted lotion or anything like that, like the Skin Better is my friend. Or if I'm having like a little like, if I like worked out and my skin's like, ooh, like we're a little spicy still, then like the Skin Better is really great because it has that green cast to it. So it really counteracts the redness very effectively. But again, it's a very narrow window of skin tone and shade. It does better with someone who has red undertone, like a pink undertone, because it counteracts that. If you're already really neutral or you have a yellow undertone, it's probably going to make you look like you're sick. So I actually have both of those always in my personal back bar where I'm like, I use the elastin every single day. If I'm a little bit more fair, I can mix that Skin Better in with it. If I'm like, I'm just raw talking life and I have no tint on, then I will use the Skin Better. Color Science, I can't use on my face. I'm very combo skin and I will get very oily in my T-zone. Color Science, if I use it like on my full face, by like 1 o'clock, I look like an oil slick. But for my drier patients, they thrive.
I can dry it down a little bit because I'm also very oily. Like if I use a Color Science, I'll either mix it.
But think about trying to use that in the summer.
Oh, I have. I looked very oily. I've since changed my ways, but I've also found like the most amazing setting powder ever. Like I scream it from the rooftops.
Oh, yes. Other thing, I'm not a foundation person. I don't want it. My skin doesn't thrive with it. Skin needs to breathe, but put a little setting powder on top of your sunscreen and it looks amazing. And it literally it looks like a foundation. Your skin is still able to breathe. I know this is not like aesthetics at all, but it's really, really helpful. And no one ever told me that. And it literally looks so nice and flawless and stays on all day. And it helps absorb that little bit of excess oil. So whatever powder you use, just put a little bit on your sunscreen and like that can be your new substitute for foundation. And it's amazing.
That is the goal though. Like I just use SPF and then a little setting powder and a little bronzer, and that's my goal for all my patients.
Yes, genuinely none of my patients, like they really don't use foundation anymore. Like I have a handful where it's like, if they're doing special events or they're like actors or they're like performers and things like that, I'm like, of course they're going to use foundation for like that type of stuff. I'm like, I don't know what my face would look like on camera.
Under many lights, you do need like a little bit of a heavier look, That's I understand.
I was like, you can see my veins. So I'm like, I would like the coverage. I'm like, it's not even like you're worried about anything else. I'm like, it's just like, I don't want to see like every piece of vasculature in my face, with that. I don't like need to look translucent. The fun thing is like having those different things, like you can do like an entire makeup look with tinted SPF, right? Like I always have a bronze on hand. So like I will just throw a little bit of like the Color Science bronze on my cheeks and my nose. And then I look like I've been in the sun, even though I have not seen the sun for many a year on my face. And those are things where it's like, okay, that's like a no makeup look, but like you look like you have absolutely perfect, beautiful, flawless skin. And while you're going through like the transition of, treating your skin and other things, it's really nice to have that. And for some of us, it's like I treated my rosacea amazing, but now I'm like too pale. So that's where I'm like, I need a little bit of bronze or a little bit of glow just for myself to like that little bit of like, I like that dimension, in my space. So I'm like, that's the irony of having rosacea, clearing down all of the redness over many years and then being like, wait, now my face is too pale.
Protect the face from the sun. I do still sun my body, but big hats, big hats.
SPF every 1 to 2 hours, continuously on a loop when you're outside, 100%. Although I cheat, you know me, I cheat. I use like the glowy SPF. I use the powder sticks. I like the Kopari I love. Like it has a little shimmer to it. And like I love a little like SPF cheat because I will reapply it when I'm like, oh, my skin looks all shiny and and glowy. And they still have an SPF. I will still mix it in with regular run-of-the-mill sunscreens too. But I do love something that like is a little bit of an incentive to apply. Otherwise, I genuinely, I find myself being more forgetful. So I'm like, make it easy for yourself. Buy something fun that is also effective. It will make you use it and it will save you, many scary trips to the dermatology office later on in life.
Side note, I do love that Kopari like body gel glitter. I love that. But also, I do tell patients like, especially when it comes to SPF, I feel like there's so many different formulations, like so many different textures, like so many finishes that I'm like, okay, if you haven't found the one that you're just like, I want to put it on every day, then we haven't found the right one for you. And that's okay. But like, we'll find your one and then you'll want to just put it on every day versus, if some like weird thick, it leaves a purple cast or like it smells weird, like you're not going to use it.
No. And that's the thing where it's like, I was that person for many years. I was that person for many years because every single SPF broke me out. But I genuinely am so open and I just want to hear from other people if they have suggestions. Like, please reach out to us with great tinted SPFs for darker skin because I haven't been as successful at finding like a tinted SPF that goes like deeper than like the bronze or the deep shade from Color Science.
It's not dark enough for a lot of people.
No, and there are some foundations, like Fenty does some really beautiful darker foundations, which is more helpful, but like it's not a true tinted SPF. It's more of like a foundation base.
Mhm.
So like if there's a true tinted SPF that does, blue light and infrared rays and all of that, like I would love to know for my patient. Pacific Northwest, I feel like we do a lot of like that elastin. I would say that's probably like our number one. But again, even I have to mix it, right? So I'm like, it's nice to be able to, even if it's like, okay, it's really close, but like they might have to add like a little bit of a bronze or something to give it more of a dimension or to cut the white cast. I would love to know.
Yeah, share your SPF recommendations. Okay, so I think we'll cut this episode here because we could go on and on. We're going to go do one more episode. So if you want to continue to listen to hear us chat about aesthetic-y things, listen to the next episode.